Hey, everybody, welcome back to the GEMS podcast. I'm joined here today with Dr. Will Ferguson. Very excited to have him here, and he's going to tell us a little bit about himself and about the classes that he's going to have at FDIC in April 2026. Dr.
Hey,
Ferguson?
sure, great. Thanks for the intro. Excited about coming out to FDIC again. I'm Will. I started my career in EMS back in the early 90s as an EMT. Then I kind of went to the dark side for a little while, then went back to nursing school and did about 14 years of ER with some flight nursing before deciding to go deep in debt and go to med school. But I'm currently at the University of Alabama in Birmingham. I run their EMS program for the Department of Emergency Medicine. We have a pretty robust program here. We have insight to run classes in the first and second year of the medical school there, in addition to having a pretty robust EMS rotation for our residents and then a fellowship program. I also serve as the Birmingham Regional EMS Medical Director. It's one of the regions in Alabama. We have about 200,000 transports a year there, and I work for Birmingham Fire and Rescue, which is probably the largest provider. I'm blessed. I got two topics at FDIC this year. The first one is going to be on urban toxicology. Don't get excited. I won't be drawing any kind of graphics or showing any organic chemistry. That's well out of my scope of practice now. But one of the things we see is there's a lot of tox in the urban environment. People think about fentanyl or meth or cocaine, but the biggest killer in our society right now is high-speed lead poisoning, right? So it's penetrating trauma, gun violence, some people like to call it. But I'm going to go over the first 100 cases we had in Birmingham a couple of years ago and kind of talk about how integrating a whole blood program is relatively cheap and easy and is literally life-saving. So some good case studies there. Hopefully be pretty exciting and interesting for you guys. The other class I'm doing is a class on the essential medical skills for the EMT, the firefighter. It's titled Moving Forward by Riding Backwards. And, that one kind of hits close to home because if you think about the EMT, what we used to call the basic EMT, it's the backbone of EMS, right? Without the basic EMT, we have issues. You can't manage your patients appropriately. And I would argue now that basic EMT is not so basic anymore. The things that our EMTs are doing these days are things that the medics did 20 years ago. And some of the more important things they have to do is physical assessment, patient assessment, and actually making a diagnosis sometimes. And with the limited resources we have and tiered responses, we have to train our EMTs where they need to be. So I'm going to go over a lot of cool things for the EMT. It's not going to be just simple regurgitation of patho and anatomy. It's going to be some clinical scenarios and to kind of make you really critically think about the things you're doing as an EMT and see how those skills can impact patients and really save lives on a day-to-day basis. So.
Awesome. Yeah, I'm just so excited for both of your classes, and obviously, I knew the urban toxicology what direction that was going because I've read the presentation that you had submitted, and yeah, I'm really excited for that. But yeah, I think that the course for EMTs, that's also going to be something that's really really important, and that resonates well for me because you're exactly right. There's things that EMTs are doing now that it's hard to call it basic, but they're truly life-saving skills. And those assessments and recognition of pathophysiology that's causing issues for our patient is one of the first things that we have to be able to do. Obviously, if we're going to treat something, we got to be able to find it. So I'm just very excited for both of your talks and excited to be welcoming you to FDIC again. So
Yeah,
thank
sounds
you.
great. Look forward to it. Yes, sir.
Yep, we'll see you in April.
All right. It's coming up quick.
Oh yeah, be here before we know it.